Hi, everyone. Thanks so much for joining us today. My name is Terry Martin. I am a director at the National Alliance for Public Safety GIS Foundation and one of the co-chairs for the Climate and Community Resilience Committee bringing you this webinar today. So a couple quick logistical items. This is a webinar, so you are muted by default. If you have questions, we'll ask you to use the Q&A function. We'll also try to monitor the chat. So as those questions come up, please just pop them in and we'll try to ask them as we go. We'll also, if there's any time at the end, we'll also try to address any that we didn't admit during the webinar. And then lastly, as you heard, this is being recorded and will get added to our YouTube playlist. Usually within like a day or so. So if you registered for today, you'll get an email when it is ready. So with that, there is some exciting news. As you can see here on the screen, ERISA is now the Geospatial Professional Network. This is big news. The name was just announced, so please forgive me if I slip at some point throughout the webinar. Also, I will make sure I want to make sure that you recognize that this is a transition period, so the branding will get updated, I'm sure, over time. So you'll still see some ERISA stuff throughout. So definitely appreciate your patience. So a new name to better reflect the professionals that make up the organization, but same important mission and purpose. GPN is a multidisciplinary geospatial organization that provides professional education and training like this webinar series we're doing right now, a vibrant and connected community, advocacy for geospatial challenges and issues, and essential resources to support you in your career. GPN fosters excellence in GIS and engages geospatial professionals throughout their careers. So much of this work is done by amazing groups and committees that you see here. The committees are listed in this bottom right box. I know it's kind of small, but you can also look across the top and you can learn more about them, follow the ones you're interested in, or become more involved. You just need to go to ERISA.org, at least for now. But just within our committee, we have a diverse set of working groups. Within our committee, we have the Climate Change and Climate Equity, the Community Resilience Working Group, which helped organize today's topic, Communications, who put together our cool graphics, funding and partners, and policies and practices. So as Frank gets started, I'll put some of these URLs in the chat so that you can explore each of the missions of the working groups and then see some examples of past work on your own. I would like to caveat that we are also transitioning. So this Experience Builder site is a work in progress. So not everything has been built out yet, but it should give you a good sense of who we are and some of the work we do. So with that, I'm excited that we continue with our very popular webinar series and another tremendous topic and speaker. I know we have quite a bit to cover today, so I appreciate you letting me take a minute to share a little bit about GPN and their news and our committee. So I am really pleased about our topic today, and in particular to have Frank Winters with us. He is the author of 10 Little Rules for Sharing Your Story, which is out now. Frank is committed to helping people and organizations communicate more effectively. As owner of Winters Geo Inc., Frank is now conducting public speaking workshops, providing personal communication and presentation coaching, and geospatial consulting. Frank finished his time with New York State as the Geographic Information Officer in 2022. He also served as the Executive Director of the New York State Geospatial Advisory Council and National Pandemic GIS Task Force Chair. He served as president of NISGIC from 2020 to 2021 and continues to be active on several work groups and committees. Frank serves on the board of directors of the National Geospatial Collaborative and won a State Scoop Magazine 2021 IT Leader of the Year award. He coaches a youth mountain bike race team, very cool, teaches wilderness guiding, and serves on national committees of the Boy Scouts, creating policies and curriculum for wilderness travel, skiing, and mountain biking. He has a Master of Science in Geography from the University of Idaho, and he has been a geospatial professional for 35 years. I will say that I had the pleasure of getting a glimpse of his public speaking workshop at NAPSIG's annual summit Inspire earlier this month in Indianapolis, and it was really good and engaging. So another reason I'm looking forward to hearing you today, Frank. So with that, I will stop sharing and stop talking, and I will turn it over to you.
Well, awesome. Thanks very much, Terry. That seems like a lot to live up to. So I feel the pressure all of a sudden. It's like, oh man, what an intro. But we're gonna have some fun. Well, I'll share the screen. I'll stop sharing at times, and we will get rolling here. But I really would love folks to be interactive here, to go ahead and put your questions in, to drive this bus. This is your time. The Geospatial Professional Network. Did I get that right? Um, that's got a good ring to it, and really happy to make these connections because we'll find throughout this conversation that the connections are one of the critical things. We talk about the software, we talk about the data, we talk about the policy, but it's the people and our ability to collaborate that really makes this whole industry tick. So the title slide here says Beyond the Headlines. And we really had a big breakthrough throughout the pandemic. The pandemic was a rough, terrible time for a lot of people, but I like to also think about some of the silver linings. And when you can flip on any of the major news networks any day and you can see a GIS dashboard, that's pretty good for our industry. That's kind of a dream come true. That's sort of the stuff we've been trying to really get into the public eye. But at the same time, there was a good deal of frustration and a good deal of, oh man, we're not really providing the impact, we not really having the impact we can have because we're in some regards kind of on the bench, and this is not the way we could be really saving lives to its fullest extent. So I like to take opportunities to build on successes and bring up the pieces that are weak and do that through relationships and communication. So with that, I am really, really happy to be here giving this presentation. I'm happy for all of you who are participating. The thing that I want to really bring out, and this is maybe what some of our discussion can be about in the chat or the Q&A, is how these concepts go beyond just dealing with a pandemic and how they can really help us pull together the policymakers, the elected officials, the folks doing GIS for emergency management, the folks leading data programs in your state, maybe from the NISJIC crowd, with folks that are at a local level, and with the public health community. So these things all come together. It seems like a complicated stew, but it really can work, and we can all be on the same page when we know how to speak with one another. So I'll stop sharing here and just give you a couple of thoughts as to get us started and get the juices flowing here a little bit. One thing I wanted to highlight, and we just talked about this with this little group before the webinar started, is there's a lot of people that have just heard enough about the pandemic. Like, oh my God, it's been 4 years. 2020 is a year I want to forget. I want to forget everything about it. That's kind of irresponsible, in my opinion. This actually is the perfect time to revisit a lot of these issues. While the TV cameras are pointing at our policymakers and the politicians are duking it out, criticizing each other about the way they're handling any matter. In that case, it was the pandemic, is really a hard time to make changes. People are kind of entrenched and many of the voices are curtailed. So this right now is the perfect time to take the lessons learned, to start to build those relationships, and to maybe share some of these resources that we'll share. And Terry, if you wouldn't mind putting in the chat now and maybe again at the end some links to some of the resources. Please don't go and start studying those links right now when we have this opportunity to be together. But these links will be there. I've got some QR codes and whatnot to share with you. But we start to pull out some of these resources, and we can talk to our policymakers, and we can use these things as a national playbook that highlights the possibilities to make some of this data publicly available. We keep talking about data that supports decision makers, and every one of the people of your states or your cities or your counties, the people of our nation, they're the most important decision makers. When it comes to a pandemic, they choose to follow the guidelines or not. They choose to put a needle in their arm and get a vaccination. They choose where they live, where they, are they going to buy a house in a hazardous area, or, so they choose where to educate or govern, to start businesses. So if we really empower decision makers at the grassroots public level, that's where I think we can, as an industry, have our biggest impact. But that story needs to be consistent all the way through, from our top elected officials through our agency policymakers to our city officials, all those folks. We can have a common thread, and this group and the groups that are pulled together here to come on this together in this webinar probably are the ones that can provide that the base data turned into information, which really is the canvas upon which the reasonable conversation can be painted. We can duke it out all we want in the media, but when you have data that's consistent through all of the tiers of information, and maybe it is presented to different groups in different ways for their needs, like the people that are managing an emergency and setting up an emergency test site probably need a different view of the data than the person that's in the office with the TV cameras pointing at them, providing the public press release, and they probably need a different view than the people who are down in the weeds trying to actually figure out the nuances of the spread of the pandemic from an epidemiological standpoint. So that data can manifest itself in different ways, but the core of the data management can be consistent. We can use it once, roll it up, and present it in lots of different ways for the needs of the people that we're supporting. So with that, I will tell you a quick little story. In 2020, before anyone knew the pandemic was about to start, I had accepted the nomination and took over as the president of the National States Geographic Information Council. I did that with a little bit of trepidation. You might not be alone if you think that a role like that, you might have a little imposter bias syndrome, where like, oh man, this is the brain trust. These people that have gone before me have done such a wonderful job, and who am I to take this on? And that was rattling around in my head. But nevertheless, I had to kind of believe the folks who had a different opinion of me than I had of myself. And maybe that's the first lesson learned, is when you're in this, you're here in this webinar right now, you're in the biz, right? Your opinions matter, your thoughts matter, the conversation you put in this chat matters, and you have a different perspective than anybody else in the world. So that's one of the things that I kind of had to like get in my head, like, no, I have something to contribute here. Well, kind of interestingly, before I took over as president of NISGIC, I got an ethics opinion. I actually requested through our public information officer of the state, and then in turn the attorneys that worked for our agency, for an opinion on whether I could speak on behalf of NISGIC without going back for approval each time, because the policies called for anyone making public presentations to get those things approved. And I made the case that I knew where NISGIC business left off and where New York State business picked up. And I got a 4-page ethics opinion giving me the green light to go ahead and speak on behalf of NISGIC. Well, then the pandemic hit, and there weren't many of us that had a voice because of those divisive politics, and the government agencies their voices were quite controlled by the political messages. As you know, in my case, Governor Cuomo and President Trump were duking it out over who was right in the pandemic, and many of us were really trying to swing the conversation back to, well, what's right, instead of what's right for your partisan politics, what's right for the people of our country, what's right for caring about their health. And there was significant overlap there, but there was a different focus that a lot of folks had. So this ethics opinion that I had to speak on behalf of NISGIC gave me a voice that then I felt a bit of a crushing weight, like, ooh, there aren't many of us that have the opportunity to speak out. Well, what should that outreach be? I am no expert. That was the best thing that happened. I am no expert in epidemiology. I happen to be really good friends with with one in particular. So I started asking questions, and I started feeling around for what the needs were. And it was a pretty interesting time to be in that role. I haven't lost sleep over work very often at all throughout my career, but about 2 weeks into the pandemic, 4 o'clock in the morning, I lost sleep. I woke up, eyes popped open, and normally if I wake up at 4 o'clock in the morning, I can barely get a glass of water off my nightstand and take a drink without spilling it all over the place, and I'm pretty delirious for a little while. I woke up with this clear outline of a paper I wanted to circulate, and some thoughts I wanted to get some people to collaborate and to help shape. And that was based on the soundbite: the spread of a pandemic and the efforts to control it are best understood in the context of space and time. And that I woke up with that thought in my head, like, where the hell did that come from? And this outline. So I jumped up, fired up the laptop, and 4 o'clock in the morning started hammering away in the keys. And then later on that day, I took another look at it and I shipped it off to some folks at NISJIC. And that kind of became the basis for a joint statement, which we will give you a URL for. And a whole bunch of organizations joined, and ERISA at the time was one of those organizations that said, yes, the pandemic should be best understood in the context of space and time, location, and the temporal and spatial relationships of all these things really matter. So that kind of gave me some confidence, but it also really made me very clear that I absolutely need to include others in that conversation, and I really don't have the expertise myself. So let me just jump into a couple of things here. And before I advance to the next slide, which I will share here, do we have any comments or questions in the chat?
I am not seeing any.
All right, we're going to give a special shout out to whoever breaks the ice here.
That's right.
So to break the ice a little bit, you know how to on your on a Zoom, do you know how to hit the let's see, what is it? It's the I just had it here. The reactions. Where is that? Where you can clap or raise your hand and that sort of stuff. Why do I not see that? Oh yeah, people are getting that. All right, so if you are the geospatial well, okay, help me with the name one more time, Terry. The new ERISA name.
Professional network.
All right, so if you're associated most with the professional network, give me a thumbs up. All right, here comes some. All right, now if you are associated more with NISJIC, give me a clap. See if we have any of those. Oh, there's a couple. All right, thanks. Yep, we're seeing it. All right, if you're associated more with the National Alliance of Public Safety GIS, give me a happy face. All right. Oh, there's some laughter there. All right, great. All right, so we do have folks. If you're associated more with public health than other industries, now give me a thumbs up. All right. Oh yeah, there we go. Nice. All right. Thanks. So I have a little feel for the group, and hopefully that was some fun. So everyone gets to see themselves rising to something larger than themselves. I want to tell you a quick story. And many of you in public health know this story and know the place that I'm standing here. But I want to put this into a little spin for you. Dr. John Snow was a surgeon and not an internal medicine doctor. Cholera outbreak in London in 1854, before modern germ theory was really had really taken its own, and certainly before epidemiology, and certainly before a map-based epidemiology was even in the thinking. Dr. John Snow challenged the conventional wisdom. Cholera outbreak was being just devastating neighborhoods, and it was thought to have been spread by an effect called miasma, which is bad air, is what that translates to. Air from rotting material and airborne infection. Well, Dr. John Snow had a theory that maybe that wasn't the case, and he wanted to figure that out. And he didn't do that using test tubes and microscopes. He used a map. And on this map of Dr. John Snow's work here, he made a little black bar at every address. So this is address geocoding at every address where someone had been affected and typically died of cholera. And then he looked at other information that he could overlay on that map. And you can see, and if you know exactly where to look on Broad Street on the map, you'll see a word pump there. And no one had, not many people had internal plumbing in their houses. They went to a community well and pumped their water for their drinking water and everything else they used. And he was assuming that there might be something wrong with that water supply because every person who has been affected with asthma lived at a place that was closest to the Broad Street well than any other well. So he did spatial analysis on paper, and he convinced the board of guardians of the area to remove the handle from that well, and the spread of cholera stopped. And then it took years for him to really unpack and convince folks that there was a different vector and to really get accepted by the community. So I show that in this context because I challenge us. Was the data that was available to understand the spread of a pandemic or other matters of public health, was that available at a resolution adequate for Dr. John Snow to have found that well? And the answer across the country is typically no. And was that data available to unexpected contributors? And that answer, except for a few shining examples, was no. So we have something to learn from the past in this case. The joint statement I mentioned, there's a link here, a QR code, and that really lays out the foundation for what then really became the oh, I'm sorry. Here's another piece of material. NISGIC published a GIS 101. So it's a series of podcasts or videos or whatnot. In this case, a YouTube video, kind of explaining and putting a little bit different spin on what we're covering here today. But that really formed the basis for ERISA and NAPSIG and NISGIC to get together and create this National Pandemic GIS Task Force. Now, one of the things that the task force did early on, and NAPSIG was instrumental in this, is they did a hot wash. And a hot wash is an opportunity while you're still active in an emergency of any type. You start to talk about what the impediments are, what's working, what isn't working, and how effective different groups are in playing the role that they're playing. And that was pretty telling. So we'll cover that in a moment. So we had up in the top of this graphic, we have ERISA, NISGIC, and oh, I'm sorry, on the right side, NAPSIG, ERISA, and NISGIC were the original three players. And we quickly decided that, ooh, we really need the public health folks. So we communicated and brought in the National Alliance of City and County Health Officials for the local public health kind of an angle, and the Association of State and Territorial Health Officials. And with these five organizations, we really had a good synergy going. It turns out that these folks that were involved in this task force, we just had one or two from each of the organizations. They were all shakers and movers. And by the end of the task force, they all had gotten promotions to different jobs or left, and it was really just kind of me at the end, last person standing. But Bree Yates, give her a shout out from NAPSIG. She was determined to work with me to make sure the findings actually saw the light of day. And so hats off to all of these organizations for the contributions. And we wound up with a National Pandemic GIS Playbook, which is kind of intentionally and knowingly incomplete, because this is the kind of thing that needs to evolve, and folks that are engaged need to continue to have an ability to add to and edit that playbook. It's one nice thing to have a playbook if you're a GIS practitioner and you kind of know what to expect. but it's a really nice thing if you have a playbook when you can kind of get your way by saying, okay, here is what the recommended best practice is, and we need to expand our view on data policy. Maybe you're giving that to a decision maker who doesn't push GIS buttons, or you're able to enlighten your elected officials, and you're able to kind of get that same message out. So this really is not a technical document. There are some technical aspects we'll get into, but it's really a document that it's really meant to pull folks together. So if you're wondering from your position who your NISJIC representatives are and who has, for instance, their advice on the best geocoder to use, and we'll cover some of this, or you're wondering who really manages public health at a city level, or at the state level, or who really manages GIS during emergency, or who are my local government GIS practitioners and experts. These organizations, it won't be hard to find all the folks to build all the relationships you need. So a big part of the playbook and the task force is just to create the awareness that, yes, these organizations exist, and we've got an awful lot of overlap in what we're trying to accomplish. So the hot wash, that's a picture of one of my dear friends, Dr. Casey Rondallo. And he gave the keynote at our first presentation about this hot wash. He's one of the country's top disaster epidemiologists. And he, at the time, was a professor of emergency management and epidemiology at Adelphi University. Now he is the executive director of one of the big healthcare, what do you want to call it? The collaboratives, including hospitals and doctors' offices and whatnot in New Jersey. But I happened to become friends with Dr. Casey at a Boy Scout camp. We have a common interest in teaching waterfront activities, and he was a sailing expert. Actually taught my son to teach advanced sailing. So those serendipitous relationships that just you take advantage of them when they happen for a reason, in my opinion. So Dr. Casey gave the keynote, and you can listen to that with the URL that'll be in the chat later. And he did a better job at describing Dr. John Snow's work, but he really made the point that from an epidemiology standpoint, we really need spatial data. We need it in the hands of everyone who needs it, and we need different views to that data. So it was really kind of gratifying that one of the top experts in the country in this area really dug in to make geospatial data a priority here. So hats off to Dr. Casey, one of the nicest guys you're ever going to meet too, if you ever have a chance to hear him speak. So the hot wash really came up with a top impediment to people not being able to be as effective as they could. The number one thing that was discovered when hundreds of people were involved were surveyed was access to adequate data. The data was in the hands of a few, and it was tightly protected, and at times that should be, but the available data for people to do their job isn't necessarily the information about individuals. It's aggregated data that we'll cover in a minute, which is no longer, once it's aggregated, it's possible to remove data that starts as under HIPAA, and to make that data that is now publicly available about the characteristics of a neighborhood instead of the characteristics of an individual. I'm no HIPAA attorney, so a little disclaimer, check with your attorneys, check with your experts on that. But the states that did that didn't have any pushback on that. They did it carefully. They did it with the same levels of protection that census uses to protect our personal information on the American Community Survey, and it really worked well. But those were just two states that I know of that did that. The other thing that was absolutely necessary was we had to rebuild or build relationships on the fly. And a lot of the relationships for other types of disasters already exists. For an earthquake or a flood or a tornado, the GIS folks that are working directly with the agencies that are in charge of managing those activities, they're routinely working together, and we drill and we do lots of stuff together. When it came to a matter of public health, those relationships were different, or they didn't exist. So that's one of the things that's one of the reasons it's the perfect time now to keep those relationships going. I'll pause again to see if there's any activity in the chat. I don't have the chat or the questions up myself, so I appreciate the help.
No, everyone's intently listening to you.
All right. Well, that's good because when you're sitting here by yourself, you kind of wonder, but that's good. So this is another resource that will kind of sum up some of what we have here. But don't look at that right now, please. We're here together for a reason. One of the types of things that we need a common understanding on was the essence of an address and how to take information about something that happened at a particular address and how to move that into take data that move that into information that informs policy or compels folks to understand the spread of a pandemic or other phenomena, and to help us understand where the strategies are, what's working and what's not in our mitigation strategies. And it's really interesting. If you have an earthquake or a flood as your disaster, and you don't do the greatest job in managing that, it doesn't bring the floodwater back, right? It slows the process, or it makes it inefficient to get your economy back and to get people back to work and to get the money flowing and all that stuff. But it doesn't make the floodwater come back. If you, on the other hand, don't have efficient and effective processes for managing a pandemic, it's like you're calling the floodwater back in. It's just going to be wave after wave, and it can really be devastating. So that was something that was a different take for a lot of folks. So a person gets tested, and that test is associated with where they live. I'll tell you a quick story. A friend of mine, who was manager of GIS on Long Island, New York, was at the pharmacy getting tested, and he heard the pharmacist tell the person in front of him in line, "Oh, don't worry about that address thing. We're not going to mail you anything." And he almost went out of his mind, right? He's like, "Oh my God, there's a data point that we don't have. That person's test doesn't count now because they didn't collect the address." And that pharmacist was just trying to do what he thought was right, getting needles in arms and getting people vaccinated and getting them out the door. And let's get as many people vaccinated. I'm sorry, it wasn't a test, it was a vaccination, and get those things done. But he missed his role in the data supply chain, that by collecting the right address, they know the rate at which people in different areas are being vaccinated, and they can start to understand that, yes, these people in this area are getting vaccinated at a high rate, and these people over here, there's must be some reason that it isn't happening that well. So that data supply chain, he just didn't know his role. So anyways, I get tested or I get a vaccine and I've got my address. Well, what happens there? The way it happened in a lot of places for the pandemic was, oh, let's just peel the zip code off the address and we'll use that, and we'll aggregate data by zip code. And here's another soundbite for you. Unless you're wearing blue shorts and carrying a mail bag, the zip code ain't for you. There is a link that we could provide that Cardo has like a 5-page blog, and the title of the blog is "Stop Using Zip Code for Analysis." And in some cases, that's all we had, but in some cases, that's all a traditional non-spatial database person or data science person might see as the thing you could use to aggregate data to a unit of geography. And zip codes, there is no official zip code boundary. Postal Service has zip codes that they just have lists of which routes get delivered in which truck and which mail bag. And it's really about a delivery. It's not about aggregating an area. On the other hand, if we took that whole address and we turned that into a discrete point, now that discrete point and the fact that someone got tested or got vaccinated there, that is private information. But when we take that discrete point and then we aggregate those all onto a unit of geography like census tract, now we have data that, depending on the policies of your folks, in a couple of places, they were able to put that out publicly, because that's no longer, in my opinion, about the address or what happened at a particular address or about an individual. Now, there's some difference in understanding of what an address is, and I like to make the distinction between a postal address and a mailing address. For my address right here, it's the same, but for a lot of folks, it's not. If you ordered a pizza, you wouldn't have it sent to your PO box, or if you were having chest pain and called 911, you wouldn't have it sent to your PO box, right? So a location address is the kind of address you would use for a 911 call, and there is some overlap, but different standards and different than your typical postal address. So when is it time to get that address right? Well, we have these web services. Web services, just a URL waiting for you to send in an address, in this case, an address geocoder, and you get back a correctly spelled formatted address. And it's as flexible as it can be on variations, and it can have aliases for postal names or for street names. And you can type in anything reasonable and get back, yes, we found you. Here's the coordinate. Here's a correctly spelled address. Well, while fingers are on keyboards for the first time, while someone's on the call in the call center taking down addresses for those making appointments for vaccinations, or while someone's about to administer a test, that would be the time that we bounce that address against a geocoder. Maybe not even store the coordinate, but just go, yes, we have a valid address, and this one is now geocodable. By the time you've hung up the phone or that person has left, you don't get to the opportunity to ask, oh, is that North Pearl Street or South Pearl Street? 90 Pearl Street, Albany, New York, doesn't exist. 90 North Pearl Street and 90 South Pearl Street are like 3.5 miles apart from each other in radically different neighborhoods. So you miss the opportunity to get that address right. And catching that data as far upstream as possible is just a matter of coding in that address geocoder so that it just works as you go. So you're going to have higher quality addresses. And then when you have those points, you can just aggregate those points, as GIS practitioners know, against any unit of geography. In this case, we're recommending a census tract. So now you have a characteristic about the census tract. Now there are other things like comorbidities and, like obesity or other factors, diabetes or whatnot, that impacted the effect of a pandemic on a community. And you might think, ooh, those are really HIPAA. Well, no, there are already characteristics of census tracts that are available where the prevalence of all those comorbidities are there. So you can start to make comparisons between the effect of a pandemic or its spread and everything that's in census, household, housing size, income, ethnicity, all of those things that census already knows about that as well as the public health metrics that are already aggregated to census tract can all start to come together. So you see how we've moved past the idea that we just aggregate to a zip code and onto something that really provides some insights. All right, we must have some stuff now. People can't hold back, I'm sure, this group. That
Um,
long.
our good friend Tim Nolan in the chat mentions that his county created a web service to share aggregated COVID data by city, and those cities were able to do their own dashboard and analysis.
Yes. Yes. And so I love, Tim, thank you for firing that up. And by city, or by county is fantastic for some uses. Vermont had the spread of COVID by county for all the surrounding states. They were keeping track of that. And if you're traveling from a county on a tourist kind of vacation to Vermont, and and you were from a particular county and the spread was over a certain rate, you were not welcome in Vermont. That was a pretty good aggregate for that use case. For understanding the nuance between one neighborhood in Manhattan, so I had friends who were working from home on the Upper East Side. They're ordering groceries in. They haven't left their apartment. They're in their thing. They're doing their work. Um, and literally walking distance, they could look out the window and see another neighborhood from their window where the spread was radically different and people had very different choices to make. These are more folks that worked at cleaning the hospital, or they worked at the grocery store, or they were driving the subway, working on the subway or whatever. And they had a choice between feeding their family or social distancing. The spread was radically different, right? So in those cases, to really understand the local variations, now you're going to use a different level of geography. And there was a couple of states that put out data at census tract as well as by municipality. So I don't want to say that one size fits all here, but the same data can manifest itself through lots of different geographies to answer lots of different questions. And that really is the realm of groups like this. You might assume that people normally in the general public understand spatial resolution because we live it. Well, we don't have a common understanding throughout our population on the difference between a census block group, tract, county, zip code. And people are just like they don't think that way, but we do. So it's kind of our responsibility to help them shape it up. So thanks, Tim, for steering that part of the conversation. Anything else, Terry?
No.
Great. All right. So once we have that address, that XY location, we stack those up, and there is some pretty interesting methods we kind of dabble in the playbook about deduping. If I got 4 tests and I'm only infected once and I had 4 tests at the same address, how is that different than 4 different people at my address? Those sort of things are some of the challenges. Clearly, I don't want to gloss over. It's hard work to figure some of that stuff out, but nevertheless, we have a way to aggregate by something like census tract, and I focused on census tract because of the richness of data that also helps explain all the variants, and we'll get into that in a second here. One other thing that I wanted to talk with you about is, and this was through a conversation, just another serendipitous conversation. I was at NSGIC, and one of our business partners was talking with me, and I was talking about the pandemic, and he's like, "Oh, my sister is working with some epidemiologists, and they have figured out a way." And she's a biochemist of some sort, and they have figured out a way to measure COVID RNA in wastewater. Like, oh, well, let's talk. So we connected, and we became friends, and it turns out that yes, you can sample wastewater at a sewage treatment plant and determine the rate at which people are submitting a sample when they flush that has COVID in the sample. And we started digging into that. And Mary Collins is her name. She was at SUNY ESF at the time. And she was able to balance that sample size with, there are some RNAs that we ubiquitously shed. So every time we flush, we expect a certain amount of this RNA to go, because it's a way to kind of count the number of people you've sampled. And it also measures how much that sample was diluted by rainwater, how much there was degradation in the sample over time as it made its way to the sewage treatment plant. So they could kind of compare, this is the number of people through our regular normal RNA, and then of those people, how many of them had COVID. Think about the temporal relationship there. By the time I get infected and I develop symptoms, and then I go get tested, and my test data winds up in a database that then gets aggregated and deduped and whatnot, and how long between when the infection happened and I show up in the data. We've found that sampling wastewater is about 8 days faster, and that's a huge benefit. So then, if you think about the public works data, and you see a spike in COVID in your wastewater treatment plant, now if you're really dialed in with your city and you have the sewer network, well, first, what does that mean? What unit of geography? Who have we tested when we test a wastewater treatment plant? Well, there's a sewer shed. And from the parcel and assessment data, we're able to determine these are the people who are connected to this sewage treatment plant. And these are the people, these are the addresses or the parcels that it should be removed from that because they're on private septic. And that's all in the assessment data. So we were able to say, okay, this is the area you have just sampled. And now you're able to compare that with the rates you see, validating the models as you figure out what's happening from testing and that sort of stuff. But now, if you take your public works data and you've got the actual network of the sewage system, you can start to walk upstream, and you can start to narrow down the areas where the COVID RNA is higher than other areas. And at Syracuse University, they were able to test at a manhole right outside of one of the dorms eventually, and they found an outbreak of COVID before anybody had symptoms and before anyone was tested, just by walking that sewer network upstream. So an interesting note here, the same sort of thing works to test for opioids in wastewater or other public health things that are part of the human system that get um, into our wastewater systems. So these same practices of understanding who's submitting that, understanding the parcels and all that stuff applies to other matters of public health. Now, if somebody is done with opioids and dumps the pills down the toilet, you're going to get a spike and you're going to be able to pull those things out in statistics. All right, so what do we have? I had a couple of thumbs up. Thanks for those. It's good to get some feedback as we go here. Do we have more thoughts or questions? Who has a different way to look at things? Any of those things would be good. All right, hearing none, I'll charge right along. One of the things that I worked on in my master's work as a geographer was spatial regression. And that is, there are variables, and some of those variables might explain a percentage of the variance. In this case, I'm talking about the variance in the spread of a pandemic. Clearly, neighborhood to neighborhood in New York, we saw radically different spread rates. But what are some of the variables that might explain that? And if you had a variable, housing size, household size, the income, ethnicity, um, an indication of how much you're moving around, because cell phones are moving around inside or outside of a census tract. Those are all things that might explain a percentage of the variance. And you can just stack a whole bunch of those up and see which ones explain the most variance. And there's a correlation, maybe not a cause and effect. But then what you get is a coefficient to apply to that variable. So you come up with a predictive formula. And that's what regression really does. So when we talk about cell phone movements, the data is available for sale. There's companies that aggregate the movements of cell phone. It's anonymized, but they can kind of tell us, all right, within a census tract, how much are people moving around? Are people hanging up in their apartment, ordering groceries in, or are they moving around? And there's reasons that that might happen. Some might just be ignoring the warnings of government because they're listening to someone that tells them to, and others are for real valid reasons, like they really have to go to work and they have the kind of job that's those critical roles. But in this case, here's a way to look at how do you take trillions of cell phone tracks and boil them down to one number that applies to a census tract every day or every temporal sample size, so that you can use that cell phone movement for inbound as one of the variables that explains the variance. All right, Kevin, we have a raised hand.
I think he might have raised that a while ago instead of a
Okay.
reaction. But
Okay.
Since we're talking about spread, Tim did have a question. Esri has the notion of a risk surface to determine the likelihood of an outbreak. Have you used a risk surface?
I have not, but I would love to hear more about that, and maybe that's the kind of thing we need to put in as a next version. If you want to put a couple little synopsis of what that is, like I say, I'm no expert in this stuff. I just pulled together some folks that we had available. Thank you. So just a quick explanation of this. If we had a measure of, okay, every time a cell phone moved from one census tract into the one we're trying to study, that would be an accumulated point. So say we had movements of folks, and some of them were coming from a relatively low a census tract that had relatively low infection rates into my census tract, and some were coming from areas with high infection rates. We could kind of weight those scores and aggregate automatically the cell phones tracts that had moved into that census tract, and each census tract could then get a number, maybe a daily number of how much inbound movement, how much potential inbound. It's kind of a measure of that. It's maybe not very precise, but when you have trillions of cell phone tracks around the country, the the degrees of freedom on the statistics are pretty high. So that's one of the variables you might have. And then the rest of the variables on housing size and census, other census type variables might be something else you compare with that. So that's the kind of thinking that's in the playbook. And then you would come up with a formula that says, okay, your inbound cell phone index multiplied by this coefficient plus household size multiplied by this coefficient plus, and you wind up with a formula that then predicts if this were to happen in an area with these same characteristics, this is what you would expect for a rate. And then you compare that with the actual rate, and then you can kind of start to see, all right, how are my control metrics working, and what do I have? One really fun example was during the analysis of how well um, vaccinations were working. And Dr. Casey had a great quote on that. He said, "Vaccines don't save lives; vaccinations do." And actually, getting needles in arms is what saves some lives. So when there was areas, and the folks in Long Island again were looking at how much uptake is there in vaccinations, and they saw one or two census tracts that were really anomalously low vaccination rates. And then they just started throwing other data at it. It's like, what else is different about these census tracts? And there's a couple of census tracts where English was not the main language, and they say, well, in our haste to get vaccinations in arms as quickly as possible, we're only answering the phone line that you call to make your appointment in English. They added Spanish and Portuguese to that, and all of a sudden those census tracts are no longer anonymously low. So it was a quickly informed anomaly that was taken care of. So that's the kind of thing that just kind of enlightens us, because the data exists. Let's use it. So with that, this artwork that you're seeing along the way here, Tom Frazier is a fantastic artist, and he provided his goodness by just having some illustrative stuff that were kind of his impressions of the pandemic that became part of our presentations that we went. And that's just an example to, like, is an artist part of the solution? Well, yeah, right, because he's got a different take, and that's gonna resonate with someone, right? So those are the kinds of things that creating those relationships and figuring out what role folks really could play is super important. All right, so who has the first comment or dissenting view? Who has another way to look at these things? There are people way better versed in public health than me. I just happen to be in a position to have a voice and pull some folks together, but I really am curious to keep shaping this, and I really am looking for opportunities to have the playbook live on and grow with our collective knowledge growing.
So as folks start to compile their thoughts into the chat, since they can't come off mute, I'll just read for you, Frank, the kind of short explanation of what Tim shared. It says, epidemiologists use relative risk surfaces to compare the risk of disease or illness over an area of interest. And so they have like a whole lesson for folks to walk through to apply these principles in GIS. Looks quite fascinating.
That's great. Thank you, Tim. I love it. I love it. So don't be shy. Your thoughts, even if it's something you think I might have covered, if you're wondering, your thoughts are super valuable to everyone on this call is valuable to playing a role in this.
So one thing I will, I guess, just pick your brain about, Frank, is this idea of building relationships prior to incidents. And certainly, as you indicated, COVID really highlighted the lack of relationships between the emergency management community and the health community. I witnessed it firsthand, supporting emergency management and collaborating at the federal level with HHS. those were loose relationships, I will say, prior. They
Yeah.
existed, but they were still quite loose. And it really took some trust to be built to open up collaborations and groups that hadn't been opened up before. I know, especially with health data, it is it's like law enforcement data. It's so tightly held. And
Yeah.
building those relationships early on so that you establish these trusts, these mutual agreements, cannot be overstated, right? In the middle of COVID, as you mentioned, there was political things were locked down, access was really tough. I don't know if you have advice or other thoughts as it relates to building those relationships ahead of time.
Yeah, that's a great question. Thanks, Terry. And I do the folks at all levels, if you call your state GIO and maybe you're a city practitioner or a public health person in a public health agency at the county or whatever it is, and you call your state GIO, there's no dumb question. Those people got to where they are by not necessarily being the expert, but knowing how to connect people, and that's what they're typically good at, and they love this stuff. If you go to a NISJIC meeting, like I'm sure many of your meetings, it doesn't stop when the presentations are over. No, these people can't shut it off, so they'll talk to you. Um, and those relationships start as individual relationships because you kind of build that trust. Maybe you run into somebody at a conference or you'll have a beer with them and you start talking about, yeah, we have a lot in common, but you offer something that is going to help me and I offer something that's going to help you. And we approach those with curiosity. We might be certain about some things, but the approach is always, I can learn more. And now those individual relationships, that's good, and that's a good starting point. But as I was wrapping up my presidency with NISJIC, I wanted to make sure these relationships didn't go away as people go away. And this is a good example. The fact that here someone that is really closely aligned with NISJIC is talking to folks from the Geospatial Professionals Network, um, because that relationship is now kind of our institutions are bound around something we want to do together, and we know we need each other. So when those relationships move from individual into work that our agencies or organizations have in common, and we see the value of each piece of the puzzle coming together, that's where it can really work together. We are way better off in this industry than others. GIS by its nature is a collaborative set of technology and it draws collaborative people. So we can really show the way, and we are showing the way um, far better than a whole bunch of traditional database managers or whatever don't have. They have to have planned way ahead of time to have the keys to connect all the data and all that stuff. We can just add data spatially and it all comes together. If you have all the data you need to get your job done in GIS and you own it yourself, all the data you need, probably doing something wrong, right? Because we're not relying on the expertise of others. So coming at the folks that are going to be providing a piece of that puzzle or a piece of the policy or whatever with that sense of curiosity, I think is key. Great question. Thank you.
100%. I don't know if this mentality does exist in other industries, but GIS people are by nature sharers, right? We want to
Right.
share with each other. We're usually stuck within policies and frameworks that make that difficult, but that's
Right.
not usually coming from the GIS folks.
Well,
So I,
yeah, and on that, we can do hard things, right? We can use things like the playbook and challenge those policies and let folks know that are making those policies like, what did your pants look, what the cuff of your pants look like when this policy went in place, and what did your cell phone look like? Is this a 1975 policy, or are we talking about a data supply chain that really benefits the people of our state or county because they're using their phone to find this. So some of this is public. So anyways, didn't mean to interrupt.
No, 100%. I think that's why I like organizations like NISJIC and Eurissa so much is that you have jazz professionals from across industries, right? So we do get to meet and meld prior to when we need those relationships. So I will say that I know we are running towards the end. There are a couple additional questions in the chat, and what I'm going to do is send them to you, Frank, so that maybe you can answer them offline, because we're going to put your links on the with the materials, because they're all really great. And I will also maybe try to pull the Q&A together so folks who didn't get to attend can see those as well. Um,
Sure.
so thank you so much. I always enjoy listening to you and your presentations. So I really appreciate you pulling this together and sharing the insights. They're so incredibly valuable, especially if we want to continue to remember collectively the lessons that were learned, so we can be better prepared to effectively support, health emergencies, health um, in general, right? We are not experts, right? We don't want to put out misleading information. We want to make sure we're using best practices at all times. So I appreciate you sharing all those links that bring all those things back together. So I did want to kind of close out with some upcoming dates. I know we're 1 minute over. This will probably take me another minute just to make sure that these things are on your radar. So I mentioned that Frank spoke at Inspire. This event brings together decision makers, first responders, and geospatial technologists. So our next webinar will be a recap of that event and so key takeaways. So if you didn't get to attend and you just want to hear what it was about and some things that we think were important and we want to communicate, you can certainly tap into that webinar. That'll be on the 7th. Also in November, the Vanguard Cabinet will be passing the torch to the new slate of leaders with a fun MAPI Q&A. The committee December webinar will also be on December 10th, sorry. And that will be on high resolution coastal land cover for the nation. And that's going to feature Nate Harold from NOAA's Office for Coastal Management and moderated by Dr. Norm Levine from our committee. And you guys can always scan these QR codes at the bottom of the screen. And then the GIS Leadership Academies, we have 2 coming up. One is virtual. I've never heard a negative thing about these academies. I've only heard tremendous outcomes, so certainly something to look forward to. And then a couple of conferences on your radar, just to keep in the back of your mind: the LEAP conference in January and the GIS Valuation Technologies Conference in March. And lastly, if you have not heard, the next GIS Pro will be in the Rockies. Very exciting. GIS Pro is a great conference where, it's such a good time to network with people across many industries. You have those conversations that Frank mentioned. You have some similarities, and then you make these connections ahead of time, and then you hold on to those relationships. Like Tim, who I got to meet in person at a EURISA conference. I don't even want to say the date because it's probably a really long time ago. I can't recommend these types of networking events enough. So thank you so much for attending. Thank you, Frank, for this presentation. It was really valuable. I appreciate you kind of sharing these insights that a lot of people were so busy that might have been had head down and just missed. So as was mentioned in the beginning, this was recorded. So if you registered, it will be, you'll get an email in your inbox that says it's available. It's also on our YouTube playlist. So you can always go there to see this and all the other ones that we've had in the past. So with that, thank you for hanging on an extra 4 minutes. I appreciate y'all being here. I hope you have a wonderful weekend ahead. And then we will add all of this stuff to the page. So if you missed anything in the chat, don't worry about it. We'll get it for you. So thanks so much and take care.
Thanks, everybody.